WCF.org.
I'm Matthew Petty, and this is Intersection. After the Pulse nightclub shooting, mental health organisations mobilised to provide counselling. The Mental Health Association of Central Florida used a grant to create a new program to help people affected by the shooting with free mental health counselling. Now they're looking for funding to keep operating. The nightclub shooting hit especially hard in Orlando's Latino community, and coming up we'll hear from Hispanic Family Counselling of Orlando about their response to the tragedy. But first, Yasmin Flasterstein from the Mental Health Association of Central Florida. Thanks for joining us.
Yeah, absolutely. Thank you for having me.
So after the shooting at the Pulse nightclub last year, the Mental Health Association started a free counselling program. Tell me about how that was set up.
Yeah, 4 days after the Pulse shooting last June, we had our annual luncheon that Glenn Close attended. She actually donated $50,000 for us to start this Orlando United counseling program, and now we've been offering free counseling to anyone affected by Pulse, either directly or indirectly without discretion.
Now, in that 4 days before you had that meeting, was there already a demand? Like, were you already seeing people show up and saying, we need help?
Absolutely. We do have a referral hotline for mental health resources, and we definitely had a huge influctuation of people needing services and needing culturally competent services, counselors that spoke Spanish and therapists that also understood LGBTQ cultural competence.
So tell me about the range of people you were seeing. Were you seeing people who are first responders, people who are at the club that night? What kinds of people have come to you for help from this program?
We've had all sorts of people come reach out for help. We've had primary victims. We work directly with the Orlando United Assistance Center that did refer anyone needing mental health resources to us. We also had secondary victims that were either family members or friends of people that were there that had passed away. And we also have community members, which might be anyone from the LGBTQ or Latinx community, or even just somebody who has PTSD in the community and a lot of things resurface because a traumatic event happened right by them.
Did you have enough counsellors that you could call on from the get-go, or did you have to really dig deep to find people who could do the job?
There were a lot of counselors that reached out right after Pulse, really wanting to help. What was important was that we got counselors that were willing to not just help right then and there, but to help long-term. Counseling can require easily up to 7 years of counseling, so we needed counselors that didn't want to just help right there in the crisis, but that would stay with us so that clients don't have to transfer a therapist or anything like that.
So what's the demand like now? Did you see a surge right afterwards, and has that tailed off, or has it been fairly steady in the almost a year since the shooting at Pulse?
It's been more steady than you would think it would be. A lot of people weren't ready to reach out right away, or symptoms might have resurfaced later on. So it wasn't, we continuously have more and more clients come in, whether it be the anniversary of Pulse coming up or it be the birthday of someone who passed. There's a lot of reasons why people reach out for counseling long after the traumatic experience.
Just coming back to the funding part of the picture, you mentioned the $50,000 that got the Orlando United Counseling Centre kicked off, and your CEO, Candy Crawford, told the Orlando Sentinel the program could run out of money. So is that a possibility?
Yes, the success of our program depends directly on funding. We don't have a dedicated funding source that's ongoing. We're constantly looking for new funding opportunities, so the success of our program is directly dependent on the support of our community with funding.
And I guess it's important to note that this is a free service, right?
Yes, Orlando United Counseling is an absolutely free service. Everything is paid for. If people have transportation issues, we have therapists that will go in home to meet with you. We have therapists all over Central Florida so people can find someone right by them, and everything is paid for. We even have outpatient care if necessary, psychiatric care past just counseling if needed. We really try to fit the individual needs of every client.
Is there a kind of a barrier for people trying to get help? They may need it, but they might not realize how to get it, or they just might not realize that it's okay to seek help?
Absolutely. There is a huge stigma surrounding seeking mental health treatment in our community. There's a stigma within a lot of first responders where people kind of think if you reach out for help, you're not okay. Mm-hmm. And nobody in a professional occupation wants to say, I'm not okay as a first responder. So there's a lot of stigma surrounding first responders wanting to reach out for help. There's also a lot of stigma within the Latinx community, where in Hispanic culture, it's not really typical to reach out for help. So we have one barrier of making sure there's free services, but the other barrier of convincing people to use it. So in addition to our counseling program, we also have free educational workshops that we put on. And the hopes of these workshops is to break the stigma of mental health in the community and to also teach leaders what kind of symptoms to look for so they can reach out to people.
Yasmin Flasterstein is the Program Director for Orlando United Counseling at the Mental Health Association of Central Florida. Thanks for joining us.
Thank you so much. Thank you for having me.
This is Intersection on 90.7 News. I'm Matthew Petty.